COVID-19, as we just heard, has shed a light on how vulnerable countries and their citizens are, and how important it is to protect the people, even if it means a complete lockdown of public life and the economy. With regard to our topic here today, the focus is similar: to protect citizens from hazardous chemicals, to sustain their health and their well-being, and at the same time to identify which chemicals are mostly beneficial and which are not. Again, a balancing act. Let's hear more about it from an expert who over the last 20 years has conducted research in environmental politics, climate change, and sustainable development. An expert who has published extensively on EU environmental policies, and an expert who has worked with and advised governmental agencies, civil societies, and businesses. Please welcome the Executive Director of the European Environment Agency, Dr. Hans Bruyninckx.
I hope that you can see me now and hear me clearly. That would be very nice. So it's a great pleasure as a partner in HBM4EU to address you all. And after Marika's very nice presentation, I think I can set the scene from a bit broader perspective. So I will start to share my screen now. Can you see my screen now? I hope you can. Okay. Good. Well, the topic of chemicals, health and well-being in Europe, I think, cannot be discussed at a better time. Because at the same time, we understand through research like HBM4EU better what the link is between chemicals, health and well-being. And we now have a European Green Deal, which has a very clear ambition to deal with this link in a chemical strategy and a zero pollution strategy towards the future. Let me first start by looking at the consumption of chemicals in the EU 28, because the data is from 2018 and we were still 28 at the time. Well, what we see is that we have more than 300 million tons of chemicals in the European economy, used in the European economy, and that more than 70% of those chemicals consumed were considered hazardous to health. These are data from Eurostat. Now, there are different categories of how hazardous they are, and this number is rather stable. Over the last 10 years, it hasn't changed much. What has changed is, of course, that the total number of chemicals used at the global level has increased threefold since 1998, so in just 20 years, that growth is predicted to continue, as the minister also mentioned. And also with globalization, we see chemicals moving across borders, either as raw materials or in products, but also in the environment through the normal environmental and climate flows that we see. Now, if you take all of that together, if we don't do something about the hazard, but we have more exposure, we will see an increase in risks. And again, as the minister said, that can of course not be the goal. We estimate that there are about 100,000 chemicals circulating in Europe, and about 23,000 of those substances are registered under REACH. That means that a large number of them is actually not falling under what we can consider the best registration, but also assessment of hazard and risk that exists on the planet. And then still, a lot of the substances do not fall under that. At the same time, we know that the volume and diversity of chemicals will most likely increase. Now, what is clear is that it is not feasible to undertake robust risk assessment for all chemicals under the current operational principles. It will take a long time, a too long time, before we understand what the risk is of the chemicals that we use. And it is important to understand that risk, because we by now understand better the health impacts of chemicals. We know about chronic diseases better. We understand neurological impacts of certain chemicals, immunosuppression impacts on human health, but also severe and irreversible developmental effects, which we are understanding better and better even before birth and transgenerational. The World Health Organization has made an estimate of the level of chemicals that are linked to the global burden of disease, about 2.7% and 1.7% to global deaths. Now, this is only based on a few substances of which we understand the exposure and hazard, and therefore it is likely to be a serious underestimate, and some would even say a guesstimate, as there is much knowledge to be gathered. Some have also calculated the annual cost of health impacts of the exposure to certain chemicals like endocrine disruptors, with an estimation of about 160 billion on an annual basis, or PFAS, with 50 to 80 billion euros cost to health. Yeah. As we know from a lot of environment and health phenomena, and especially now understanding better the link between the two, this risk and the impacts are not spread equally across the population. There are vulnerable groups like workers with high exposure levels, as Marika has already illustrated, children and pregnant women, who are more vulnerable to health impacts. And we know, for example, that exogenous chemicals are found in the blood and urine of over 90% of pregnant women and children in a study in 6 European countries. But also the social status impacts how chemicals are having an impact on us. And this goes in both directions. Based on the study Demokofes, we have looked at pairs of mothers and children, where we looked at the educational level of the mothers. And we see that for cadmium and phthalates, mothers with low education level have higher cadmium in their body. And for cadmium, this can be explained by smoking and by some other habits. And for phthalates, this can be explained by the use of certain consumer products, some of which might not be of the best quality when it comes to the chemical substances used in them. When we look at mercury, however, we see that mothers with a higher education have significantly higher levels of mercury in their bodies. And this is linked to consumption of foods. This is primarily linked to the eating of predatory fish species. So it is important also to look at social status and unequal exposure when we are talking about chemicals. But there are also new challenges. When we think of a circular economy as a critical element of moving the European economy into the 21st century, we need to also understand the role of chemicals in this. If we look at the reuse of materials, we know that chemicals are also reused in those same cycles, and not necessarily in the same way as they were used in the original materials or the original product. So we need to understand whether toxicity is building up and how we can deal with this. We're also dealing with legacy chemicals in secondary products that were made in times where some chemicals were still used that would be forbidden today. And then we see occupational exposure at recycling facilities. And if you have visited even the most modern recycling facility, it is obvious that we are still dealing with a lot of manual labor where people are exposed to the chemicals that are in the products. And then we've got, of course, the whole issue of sludge that is reused and wastewater that is reused and that may have chemicals ending up in the food chain. So while the circular economy is, of course, one of the critical elements of a sustainable economy for the future, we need to understand the role of chemicals. Marika has already mentioned some of the solution for chemical risk governance. Indeed, the idea of one substance and one assessment, whereas we now see sometimes multiple assessments based on the pathways of exposure or based on legal or institutional segmentation. Grouping chemicals for risk assessment and management can deal with the high number of chemicals and the impossibility of deal with each chemical individually. And then we have the fact that we can tackle certain chemicals more specifically and with higher priority, like persistent and mobile substances and bioactive substances like pesticides. There's also in Marika's presentation been mentioning of the mixtures assessment, and we could implement the mixtures assessment factor because we know also from HBM4EU research that mixtures are indeed having different impacts on our human bodies. What would also be highly welcome is a coherent approach to endocrine disruptors. But at the end of the day, we think that making chemicals, products, and processes safe and sustainable by design is absolutely the way forward. And there is a whole lot of knowledge and a whole lot of science that supports this and that also shows how this can be done also at industrial levels. And we think that this should be a critical component in the innovation in Europe's chemical industry. Marika has already talked about the European Green Deal, as has Minister Schulze. And I think indeed that when you look at the forthcoming policies on zero pollution and the chemical strategy for sustainability, they could not be more important in and of themselves, with a link with human health and well-being and the environment, but also as they relate to all the other objectives of the European Green Deal, the biodiversity strategy, where we know that chemical pollution is a major threat to biodiversity. I mentioned the circular economy action plan, the farm to fork strategy, which clearly has a link with the use of chemicals and pesticides in the food chain, the just transition, where this distributional impact and factor plays a big role, and also, of course, with the investment and the industrial strategy, and on top of that, the climate change strategy. In fact, it is maybe a bit sharp to say, but I think fair to say that with the current chemicals, we will not deliver on the high ambitions of the European Green Deal. It is absolutely necessary that we see the innovation that is in line with these high ambitions. I might add, if necessary in this audience, that zero pollution, of course, also applies to the human body and not to the environment only. Now, what is the role for human biomonitoring data? I think it's clear that we need to tackle some knowledge gaps on exposure and health impacts. It's also providing us with a baseline to measure progress towards zero pollution. And if you look, without going into any details, at the graph there, it's clear that policies matter. But if policies matter and we need to follow up on them, we need baseline data and we need a continuity in data to assess trends over time. What we also need is, of course, approaches that can validate what we mean by safe and sustainable by design when this is the way forward. So I could hardly think of a more important topic, because as my good colleague Björn Hansen of ECHA often says, the chemical industry and chemicals are the industry of industries. Everything is made of molecules, and the type of molecules that we produce and use, the way in which we produce them, and their characteristics throughout the life cycle, not only of chemicals, but also of environmental life cycles and human life cycles, will determine whether we can reach the very high goals that are embedded in the European Green Deal and on a global scale in the Sustainable Development Goals. Thank you very much. I wish you a very good conference today, and I hope that important results will spill over into the policy agenda of European countries and at the European level. Thank you.